Hi everyone, welcome to another IG Live and Facebook Live of Team IBS Dietitian. Today we got some questions on food triggers, and the question specifically is what foods are commonly triggering IBS symptoms. So we'll talk a lot about food today and maybe walk you through the process of how to identify food triggers, because that is our clients with. Sorry, you can see the brief right strip here. I'm a bit sick today. Let's see. I think I saw Brooke here.
Yeah.
Hi, Brooke.
Hi.
Awesome. Um, all right. So we got this question. I think we also have some questions from Instagram as well. And we can talk more about that. Oh, one of the question is, maybe we can start here. Which foods can I find prebiotics? Oh, I love this question. Do you want to start talking about that? Maybe we can
Sure.
explain what prebiotic is first, and then we're going to talk about food triggers. Oh, wait, hold on. Before we do that, we have a quick announcement to make regarding working with us. We are getting a lot of questions about working with us and joining our group program. Enrollment is currently open. We actually filled a group over the weekend, so every one of our group is 6 people or less. So we only open 6 spots at one time, and we filled one group already. And after discussing it, we have decided to open one more group this fall. So we have another 6 spots open. Actually, we don't have 6 spots anymore because 2 people already joined the program when we opened it yesterday. So for those of you who wants professional help, who is ready to say, hey, I need help for IBS, I need help identifying the triggers, or really understand what is going on in our body, we would love to work with you. We would love to help you get better. And the goal is to start now so that you will be better before Thanksgiving rolls around. So when you travel or when you go to year-end gatherings, you know exactly how to prevent symptoms, what to do if symptoms occur, and how to feel better. And more importantly, get you ready before 2026 so that you can start living your life to the fullest. We got this comment on our post. The pain of IBS is not just physical, which I'm sure everybody with IBS really understand that, because a lot of it is very psychological as well. It's hard to eat out with friends and families when you don't know what triggers your symptoms. It's hard to go to events not thinking about where the bathroom is. Or for people with IBS-C like myself, it's like, what is causing my bloating? Why is there dull pain all over my abdominal area? But people have different types of pain. But then I just want to respond to that comment. It's kind of rude because you don't know other people's lived experiences, and if you don't have significant IBS symptoms, right? Good for you. You're so lucky. But a lot of people with IBS have significant symptoms, and we know that because the AGA, American Gastroenterology Association, recently released a survey they did. On average, IBS patients have to make changes to their days around 19 days a month due to IBS symptoms. This, oh, sorry, I got cut out. So
That's fine.
19 days out of a month, they have to change their activity to accommodate for their IBS symptoms. This is a significant disruption of anybody's life, and a significant such debilitation, and really affecting someone's quality of life. It affects, how you plan your day. It affects how you plan your month. It affects your family time. It affects your work. And actually, we hear this again and again and again. People are afraid just driving to work, or people are underperforming because they are feeling so sick all the time. They're just not feeling well. But another thing about IBS is we don't want people to know that we have IBS. We kind of just hide it, right? I mean, for those of you who have IBS, do you agree? Like, we just kind of hide it and be like, yeah, I'm not feeling great, but I'm okay. Because if you complain a lot, like we usually do, because it's just very uncomfortable, people will listen to it when they first hear it, but people will tune out eventually. And we know that, especially with our loved ones. Um, I remember Laura said that on her podcast. Like,
Mm.
I have the most amazing husband, but what did she say? Do you remember? Like,
No.
but it's really funny. But it's like, is it like it can be dismissive if we say it a lot, and with IBS, it's not like, well, it's gonna go away. The
Mhm.
fear of having a flare up or the fear or the pain is always in the back of our minds, right? And yeah, I just want to say, don't be rude and discredit other people's experiences. And if you are struggling, if you are suffering, we are here for you. We hear it. And for those of you listening on Facebook, I just posted a comment. I just posted something yesterday to ask about how Facebook is affecting your life. Oh, actually, let me read that out a little bit because I think people need to hear it. It's not easy. It's really, really difficult. Okay, I'm gonna read a few of it. So somebody said, I need to plan if it's worth going out to a function or is it easier to stay at home? Usually I just stay at home to eat. Mm. Low key, my IBS is the reason I carry a whole bathroom survival kit. Can't
Mhm.
trust my stomach or public restrooms. Booty mist lifts in my back now. We hear that all the time. We had a client, Deb, talks about she has to bring changing clothes, wipes, towels with her everywhere she goes, just in case something would happen, right? And for those of you who struggles with this, know that there are ways to really manage your IBS. If you want to hear their stories, go to the IBS Nutrition Podcast. Here are patients who went from having extreme debilitating IBS symptoms, diarrhea, pain, some of them constipation, to now living their life to the fullest, knowing
Mhm.
what is triggering their symptoms. And here somebody um, who's also said, I have to be careful. I'm near a bathroom after I eat. And we hear that a lot.
Mhm.
So, IBS is extremely debilitating. Do not be rude. We had to remove somebody in our private Facebook group today because she was very rude towards some of the members, and it's just not nice. Okay, talk about food. No, we had a question about prebiotics. I think this is really good question leading into understanding food triggers. But first, let's talk about what is prebiotics.
It's basically food for probiotics.
Well, no, actually, there's a distinct difference between probiotics and our gut microbiome, right?
Right. But
Yeah.
my understanding was that prebiotics were food for the probiotics in your gut.
Yes, it can be. So a lot of the times, well, probiotics is very specific. It is supplements that we take that have a beneficial, that have evidence for benefits that helps a specific condition or
Oh,
symptoms.
right. So
Yes,
oh my gosh. So prebiotics are food for microbes or
yes, yes.
our gut microflora. I can't talk today.
Our
Microbiota.
microbiota, or our gut
Yes.
microbiome.
Yes.
Yes,
Yes.
and prebiotics are carbohydrates, are actually fibers that goes into our gut and they feed our gut microbiota and help our gut microbiota be stronger. And you often so let's go back a little bit about probiotics there, what I talked about probiotics. So probiotics are specific strains of microbes. It may not be a bacteria because of it can be yeast, it can be other things as well, but they have to be specific strains of it, which most of the products on the market, they don't even tell you what strains they have. They
Mm-hmm.
might have the first and the middle name, but they don't tell you the strain, which is usually the last name on a bottle. Oh, I wish I have
Mm-hmm.
a sample here. I don't have a sample here that really explains it. We have a podcast episode on probiotics. So go to
Mm-hmm.
IBS Nutrition Podcast, look at that. We had one of
Mm-hmm.
our colleagues, Baby Hannah, come on to talk about probiotics. what to look for in a probiotics, how to choose one for IBS. And there are a few that are evidence-based, but again, be careful, because even though they're evidence-based for IBS, it has to be specific for your symptoms, right? If you have diarrhea and you take something that has evidence for IBS-C, it can potentially make your diarrhea worse. And we have seen cases like this multiple times. And usually we always tell people, like, stop everything you're taking if you are taking a probiotics, because one, you don't need to take a probiotics long term for IBS. It's not necessary. Even with the clients we work for, we may have them try one or two, depending on what symptoms they have. But it's always short term. Once we achieve our goal, whatever the goal might be, we have them stop it. And then we evaluate to see, what other actions we need. It's part of the process. It can be part of the process for some, but most of the time it's not part of the process for everyone. So just letting you know out there, and most of the probiotics on the market don't even tell you what strains they have, which is really deceiving. They could say they are lactobacillus, but it doesn't tell you which lactobacillus they are. So for example, there's one lactobacillus rhamnosus GG. So it's called lactobacillus rhamnosus GG. Rhamnosus GG is the strain. It's not lactobacillus. Lactobacillus is the family, is the species that they are in. But you need to know the strain. Usually it's a number with some alphabet near it. So those are the strains. And if you go to the supermarket or health food store, you will see those bottles. Most of them will say they have lactobacillus, but they don't tell you which strain it is. And depending on the strain, it may not be effective for IBS. And more, I should say, more often what we see in our clinic is that these probiotics actually make people's gut symptom worse. Okay, so be very careful. Now, going back to prebiotics. So prebiotics are fibers that feeds our gut microbes. Oftentimes, you will see nowadays with products, protein powder, yogurts, or whatever, or probiotics that they say they have prebiotics added to them. Or a lot of products will say they have pre and probiotics added to them. Even on skincare products, I'm like, really? It does not make sense. But anyways, it's, the mindset is I think for people, it's the more the merrier. It's not always the case, and it can have the opposite effects, especially when it comes to managing IBS. But prebiotics are fibers that our microbiome or our gut microbes break down, and they use it to, and it is a fuel for our gut microbiota and for the bacteria, the yeast, or whatever that is in there. But the key for prebiotics is that they are fiber. And what foods contains prebiotics? What is that one big category that we love talking about?
Fermented foods, is that?
Yeah. Well, no, fermentable carbohydrates. Right?
Fermentable carbohydrates, yes.
Yes, and that one big group of that would be FODMAPs, right? So FODMAPs are prebiotic fibers, and more than that, of course, when it comes to IBS, usually the number one recommendation is, go low FODMAP and see how your symptoms do. And then people started removing FODMAPs. And this is also why, FODMAPs are prebiotics, so they feed our gut microbes. This is also why when people go on the low FODMAP diet for prolonged period, more than 6 to 8 weeks of what is recommended, their symptoms tend to get worse in the long run. And what we are doing to our gut is we are starving them of the food that can help our gut microbiota thrive and feel better. So be very careful. So we had this question about prebiotics on Instagram. We also have a question about food triggers. Now, we want to say that here. FODMAPs are good for your gut. They feed your gut microbiome. They are prebiotic fiber, especially they are short chain carbohydrates that goes into our gut. And our gut microbiome breaks it down and it feeds our gut microbiome. The problem with FODMAPs is that because they are so readily fermentable, because they're short chain carbohydrates and short chain fibers, they produce gas. And gas can cause more symptoms for patients with IBS, which is also why the low FODMAP diet is recommended for somebody with IBS. But the low FODMAP diet is not a long-term diet. It is a short-term diet. The recommended length to be on the low FODMAP diet is 2 to 6 weeks. 8 weeks if you're working with a trained dietitian and we're saying like, let's stay low FODMAP just to keep your symptoms at bay. Now, if we have somebody with significant diarrhea, we may have them stay on low FODMAP a little bit longer until her diarrhea stops, she's at baseline. But it's not just diets, right? We are also working with the patients on multiple other things to understand what is causing the diarrhea. So it's never just diet that's causing diarrhea. That could be other things that's causing diarrhea. Supplements, medications, gut-brain connection, these are all things that can make your IBS symptoms worse. Or better, medications, some medications, they work well. There are quite a lot for IBS, but be mindful, what you're taking. Always talk to your doctor. Make sure you're getting the right medication for your IBS and it's not making your symptoms worse. Sorry, what was I saying? Oh, the low FODMAP diet is not the long-term diet. And it's only one aspect of it. Do you want to talk a little bit more about what is the low FODMAP diet in a nutshell?
Sure. So there's 3 phases to the low FODMAP diet. The first would be elimination. So we have you go low FODMAP, not no fat FODMAP, but for 2 to 6 weeks. I will say an important caveat is if you've done low FODMAP for 3 weeks and it has not worked for you, it's not all of a sudden gonna start working for you. So if you haven't noticed a positive improvement, you should reroute to a different kind of diet because it's not helping. So you almost eliminate the FODMAPs, and then we do a reintroduction phase. And that phase is very systematic reintroduction of the groups of FODMAPs one by one. And sometimes we see no trigger foods. Sometimes we see a few. Most often there might be some low level reaction to things, or maybe one group that people are sensitive to. And then the third phase is kind of figuring out which your triggers are and eating up to the maximum amount of FODMAPs that you can without symptoms and going on your merry way, really. with knowing your trigger foods and being well aware, and then liberalizing your diet as much as possible.
Yeah, and that's always that's always our goal when it comes to helping patients work through an elimination diet. So oftentimes the questions we get is, Jessie, you're going to put me on more diets? And our answer is no. We want to assess what is going on first, what you're eating, what your symptoms are, what your bowel habits looks like before we decide, if a diet is suitable for you. Not everybody needs to be on a diet. I actually talked to one of our new members yesterday that wants to come and join our group. And she said she has done the food sensitivity test. Do you want to start by talking a little bit about that? And I'm seeing we have some questions in here about constipation. We'll get to it shortly.
Yes, food sensitivity tests. Well, in the future, they may have reliable science behind them. At this point in time, there has not been any scientific evidence that they are helpful to predict your food intolerances, really. And what we find most in practice is that they have people cutting out way too many foods. And people will come to us often very confused because something that the food sensitivity test has told them they're sensitive to, they eat all the time with no problems. So they are an expensive waste of money at this point. I will say, like I said in the beginning, if down the road they may be a validated tool, but at this point they are not, and usually cause more food fear than way more food fear than necessary.
Yeah, that's exactly what our new client told me yesterday. She said She's cut out all these foods. She's down to eating 5 foods that she feels safe, and yet she's still having flare-ups every single day, which is ridiculous, because the test is causing way more
Mm-hmm.
symptoms and fear and being afraid of food. Now, I want to read a statement by American Academy of Allergy, Asthma, and Immunology about food sensitivity tests. So they say it is important to understand that this test has never been scientifically proven to be able to accomplish what it reports to do. The scientific studies that are provided to support the use of this test are often out of date in non-reputable journals, and many have not even used the IgG test in question. The presence of IgG, which is what these tests measures, is likely a normal response of the immune system to exposure to food. In fact, higher levels of IgG4 to foods may simply be associated with tolerance to those foods. So if you've ever done a food sensitivity test and it showed you that you don't tolerate all of the foods on there and those are the foods that you're eating, that's probably why, because everything you're eating will show up on higher amounts of the IgG4s, which is what most of these tests measures. And it causes so much confusion, so much food fear, and just heartbreaking for us as clinicians to see people pay hundreds of dollars for these tests. And then I think the monetary part is not the worst part. It's the anxiety part when it comes to eating foods that they normally eat and foods that don't actually cause them symptoms. But because the tests say that, yeah, you can't tolerate this, and then they cut everything out. But these are not even their food triggers.
Mm-hmm.
And in the long run, like we said earlier, when you cut out food, you are removing fibers from your diet most of the time, and that can make your symptom worse in the long run, especially when it comes to the health of our gut microbiome. We know that the more diverse our gut microbiome is going to be better for gut health, for actually our general health in general. And when we are removing so many foods, and this includes FODMAPs or foods from the food sensitivity test, or you've gone paleo, you've gone vegan, or you've gone carnivore, like removing foods, it's just bad for our gut, period. How to improve gut function, you might ask? You want to eat more plant foods, more diverse plant foods. And with the low FODMAP diets, the elimination phase actually is quite restrictive. You're removing a lot of plant foods. And when you're removing a lot of plant foods that have the fiber, the probiotics to feed your gut microbe, it will make your gut microbiome weaker and make your gut more sensitive and maybe more susceptible to other issues down the road. So you really don't want to cut out FODMAPs for a long time. Now, FODMAPs do trigger symptoms in some IBS patients. The key is to understand how much of it you can tolerate for each group of the FODMAPs. Do you have the paper that shows different groups of FODMAPs? I should really have a copy of that on hand. So this is one of our handouts that we give to our clients. It's in our course, the IBS Freedom course, and all of our clients have access to it. Oh yeah, that there is. We have, is it 11 groups of FODMAPs and FODMAP subgroups that our clients will be testing through to understand their tolerance to each categories of the FODMAPs. And sometimes it's a combination of categories. So for example, stone fruits or pitted fruits. One of our clients came on our podcast on Monday and she said, I thought I couldn't eat any stone fruits, but it turns out I could actually eat them. And we just had a cherry season, peach season, and she was able to eat those again, and she was so happy. And this is somebody with IBS and microscopic colitis. It is one form of IBD. So, of course, when it is IBS and IBD together, it's more significant. We do work with all GI conditions. We specialize in IBS, but we also specialize in other conditions as well. The thing about IBS is even if you have a diagnosis of IBS, it could be overlapping conditions. And oftentimes one of the things we recommend our clients to do is to let's get more tests. Let's make sure, it's not just, If there's something we are suspecting is more than IBS, we want to get you tested. We want to make sure you get to the right diagnosis and understand what is going on. Because if you don't know what is going on, then whatever you are trying or whatever we are trying with you, it's just like, well, let's see if it sticks on the wall, right? And see what works. But no, sometimes some cases are just going to be more complex. And with those cases, like the client that came to our podcast to share her story, her case was one, right? She has IBS. She also has IBD. She cut out a lot of food, but then in the process of working together, we identified one of her major food triggers, which is not a FODMAP group. And we also worked through the FODMAP challenges to help her reintroduce all the FODMAPs back into her diet. What did she say? I think she said she can eat some garlic now and she can eat some onion now. And if it's cooked onion, she can eat them. If it's raw onion, she would not yet to be so adventurous, but she will try it in the future to see what her tolerance level is, because now she knows how to challenge them. And she can always re-challenge this group. But the key is she's reintroduced all the FODMAPs back to her diet, and she's tolerated, I think, most of them, right? All of them, but some of them maybe at a lesser quantity. So don't just go out and cut out all FODMAPs. I think she's been on the low FODMAP diet again for years, right? Prior to working together.
She had cut out a significant amount of foods for a long time. And she also had cut out all dairy and was able during the program to add dairy back in, just lactose-free dairy, and she's going to challenge lactose soon.
Yes, and this is a client who had significant amount of diarrhea prior to working together. So in those cases, right, lactose can be a trigger, but but the key is, after your gut has healed, once we've identified what's causing, all the irritation in your gut, and then allow your gut to have some time to heal. Some people might be able to tolerate lactose-containing dairy products in the future. But we usually, in significant, severe cases like this, we usually challenge lactose-free dairy first to confirm tolerance to dairy food, right? First. And guess what? Most of the time, people can tolerate lactose-free dairies. And that can include yogurts, lactose-free milk, and most cheeses out there, most hard cheeses, mozzarella, Parmesan, even brie. Brie is not a hard cheese. Mozzarella is not a hard cheese. Like, people can tolerate those. So don't just cut out food. Adding food back in is just as important to managing your symptoms and IBS in the long run. Especially, it's actually better in the long run is to add things back in at the amounts that you can tolerate, but also understand how much of it you can tolerate. But yeah, we just want to talk about that when it comes to the FODMAP diet. It's not long-term, and it is very possible to add all of the FODMAP groups back into your diet. And that's what we see with all of our clients. Basically, they can add all the FODMAPs back into their diet. Some of the groups, they might only tolerate the smaller amounts, but if you can tolerate the smaller amounts, then keep eating that smaller amount. Keep feeding your gut microbes the fiber that they need, because the group that can break down this type of fiber, they're going to grow. And then in the future, they will be able to help you break down more of these fibers so that you can eat more foods down the road. With the low FODMAP diet, it's not one size fits all. It's not a long-term elimination diet. Okay. What were we talking about? You gotta help me bring me back.
You had so I have 5 minutes and then I have to jump off, but constipation, I think you had questions on constipation somewhere.
Oh yeah, let's go and talk about that. Let's see. And there's one more question. Okay, we had a question submitted via stories yesterday about vitamin D and IBS. Do you want to talk a little bit about that? First, let me go look for the constipation question.
Is there a direct link between vitamin D and IBS? I don't think so, but
we can talk about what we see in the clinic and what we usually ask for. We do always ask for patients to get tested for vitamin D, for iron, for B12 and folates, because it is important to assess whether there's malabsorption going on. Now, there are other conditions that are not IBS that can cause malabsorption. IBS does not cause nutrient deficiency or malabsorption, but they are overlapping conditions, right? IBD would be one of them. SIBO would be another one. And then, of course, sometimes we see bile acid malabsorption. We see pancreatic enzyme insufficiency overlapping with IBS. In those cases, well, not in those cases. One of the things we always ask our clients to do is let's get you a panel of nutrients labs. We usually share our notes with our patients. They bring it to their doctors. They get the labs. We help them review the labs and see if there's any deficiency. Vitamin D is usually something that comes back to be low. Now, that may not be an indication of malabsorption. It could be you're not getting enough vitamin D in your diet. And we know that vitamin D is hard to get enough of, right? There are multiple ways that we can get it. One is from deep sea seafood. Another one is from sun exposure. But again, depending on the complexity of your skin color and your genetics, it determines how much vitamin D your skin can produce. And then it gets activated by the kidney. Sorry, I'm going a lot into the biochemistry of vitamin metabolism in our body. But with vitamin D, right, if it's lower, it may be an indication of malabsorption, but it could also be an indication of you're not getting enough vitamin D from your diet. And we have to assess your diets to determine, hey, which camp do you go into? And then that can determine our next step. If there is a malabsorption happening, then we want to investigate what's causing the malabsorption with you and your physician, right? And then we also look at other labs, right? We talked about iron, we talked about B12 and folate. These are usually all connected. If somebody has malabsorption, they're not just malabsorbing one type of vitamin. It is multiple other types of vitamins and minerals, and we really want to look at the bigger picture to see, hey, is it an isolated incident, just vitamin D? Is it because of your intake, or is it you're not absorbing? And when people are malabsorbing, one of the things we see is people have very low energy level. People say that they have brain fog. Now, brain fog is not a scientific term, but what it really means is just that people are tired, people can't think clearly a lot of the times, and they're just really not feeling well in general. So if you have a combination of those symptoms and then you have low vitamin or minerals levels, then we really need to look into whether there's malabsorption going on and what other conditions may be contributing to this on top of IBS. Because again, IBS does not cause malabsorption. There's something else going on. Oh, and then another condition we see this in is non-celiac wheat sensitivity. We are still learning more about this condition, but I just want to put it out there that it happens, it exists, and people have real symptoms with it. And these are people who have tested out of celiac, don't have wheat allergy, but they still react when they eat wheat. Okay, and this is just a general overview, and sometimes there's a genetic components to it too, and that's something we also talk about. Now, we had a question about constipation. Can whey protein powder without prebiotics cause constipation? I just recovered from a severe bout of constipation and wondering if it was the protein powder. And then for context, I have IBS-C and idiopathic constipation. Oh, yes. Hey, I'm actually presenting at Fancy in a few weeks to our biggest, the world's biggest nutrition conference. Actually, me and a couple other colleagues are presenting on constipation. So when it comes to constipation, right, we don't look at just one single food causing the constipation. It's all usually multifactorial. So we don't think about what you are eating causing the constipation. What we really think about is what are you not eating, right? The first thing in mind is, are you getting enough fiber? You know, if you are drinking the protein powder, you know, are you replacing some of the fiber, or are you using it, drinking it as a meal and you're not getting enough fiber for that meal? For context, we need about 25 to 35 grams of fiber per day to have good gut function. Now, everybody's a little bit different, but what does that look like? So a small apple, a medium-sized apple is about 3 grams of fiber. A medium-sized orange is about 3 grams of fiber. So a small banana is maybe 2 grams of fiber. A medium small banana is maybe 2 grams of fiber. So, you know, if you're eating 3 fruits, right, you might be getting 8 to 9 grams of fiber. And then leafy green is only 1 gram of fiber per cup, so it really doesn't give you a whole lot of fiber. So when we hear people talk about, hey, is this food that I am eating causing me to be significantly constipated? Our response will be, our thoughts will be, well, it's probably things that you are not eating causing you constipation. You really need to work on the foundation first. And what we talk about as foundation is hydration status, fiber intake, and then exercise. Are you doing all those things first? If you're doing all those things, then we look into, if there's something else going on, right? Is it a gut-brain connection issue? Is it sleep? Is it meal timing? Protected body time. Resolving constipation is a process, but you can resolve constipation. It's going to take time. Me, myself, very IBS-C, I do have a routine that I have to follow to make sure I'm fully evacuating every day. And one of the number one things that you can do to improve your constipation is use some over-the-counter laxative. It's very safe. It helps you have full evacuations every day, but the dosage it varies dosage depending on the person. Usually we have our clients start out on a higher dosage and then slowly dose it down as their gut function improves, as we work on the foundational things, and then also testing out food intolerances, because some of them may have a FODMAP trigger or may have other triggers such as non-celiac wheat sensitivity triggers. In those cases,
Jessie,
you do. Okay.
Sorry to interrupt. I've got to jump off.
Okay, thank you for joining me.
You're welcome.
I'll answer. Bye. Bye, Brooke. Yeah. Okay, sorry. What was I saying? I was saying resolving constipation is a process, right? So it's not just a one-time thing. Brooke, I think you're still on here.
No, I'm trying to disconnect.
Okay, I think you clicked the cross on the top right corner. Okay. All right. But with constipation, it's a step-by-step process. And if you are an IBS Freedom Program member, I wrote it using the online Google form. We do, once a month, we have a Q&A with me. That's when I answer all the questions. So make sure to check it out. Ours is coming up. You get an email every week to say when our Q&A is. So this is our self-paced course to help patients get better. Okay, so we have another question here asking, can IBS present as gastritis? I think a lot of the times this gastritis presents as IBS, because with gastritis, here are some of the symptoms we see with gastritis is bloating, pain, and sometimes belching or just more air coming back up. So gastritis can again be something that overlaps with IBS, right? And with gastritis, talk to your doctor. There are medications that can help, but remember with those medications, ask them how long you need to be on them for, and what to do. My husband actually had mild gastritis a few years ago. We did another endoscopy this year. Thank goodness his gastritis is all gone. There's no inflammation in her stomach lining. Now, it is possible, but again, it is a process. You have to understand what is causing a lot of your GI symptoms first, and then resolve it one step at a time. If there is a food triggering more symptoms, then you want to know what that food is and identify the amounts that you can tolerate. Somebody asked, what about diarrhea? We actually talked a lot about diarrhea in our last week's IG Live and the week before. We talked a lot about diarrhea. So go check those out. And in our free IBS Relief Masterclass, we talked a lot about different types of IBS diarrhea as well. With diarrhea, unfortunately, a lot of the times people do have certain food triggers. And in cases like this, you really need to identify what is speeding up your gut, right? What triggers your symptoms? How much of that food you can tolerate. If you can tolerate some of it, keep eating. If you cannot tolerate all of it, then it's not something, then you probably want to avoid it. So with constipation and with diarrhea, the treatment is different, but similar in some sense. Different as in with constipation, right? We really want to work on things that improves gut motility. With diarrhea, the key is to identify what's triggering your diarrhea and what type of diarrhea you have. So there are multiple types. There's overflow diarrhea, there's flare-up diarrhea, and flare-up diarrhea can sometimes be caused by constipation. Overflow diarrhea is caused by constipation. And then there's malabsorption diarrhea, where symptoms are triggered by can be by fats, can be by other things, but you need to know what is causing your diarrhea to stop the diarrhea and then reintroduce the food one group at a time to see if any of them do trigger more symptoms. Okay, so let's see, do we have any other questions in here? And today we started, for those of you just joining now, we started with talking about what prebiotics are, because there was one question about what foods have prebiotics. So FODMAPs have prebiotics. Something else just came to mind. So kimchi is a prebiotic food. So think foods that can make that is more fermentable. Miso is a prebiotics because they do have prebiotics fiber in them. Miso is a Japanese rice paste that you mix soup with. So if you go to a Japanese restaurant, they usually give you a bowl of soup that's usually miso soup. So it's a rice and soybean paste, fermented rice and soybean paste. What else is prebiotic? Has prebiotic fiber. Sauerkraut, which is high FODMAP, more than 1 or 2 tablespoons, I can't remember. But again, like we said earlier, all of the FODMAP foods are prebiotic fibers. They're good for your gut. They feed our gut microbiome, so you don't want to cut them out for prolonged periods. But if you want to hear more about this, go back to the beginning of the video. I'll post the replay for you to learn more. Now, let's go back to food triggers. So we talked about FODMAPs as one type of food trigger. We talked about non-celiac wheat sensitivity of people having triggers to specific foods in those cases. And then fats sometimes can be a trigger, but this is only specific to people with fat malabsorption, and there are multiple types of fat malabsorptions out there. Bile acid malabsorption, pancreatic enzyme insufficiency, that could be another one. And then sometimes sucrose isomaltase deficiency that also triggers symptoms when people eat sucrose. So that's table sugar. Now, with so many different types of food triggers, right, you really need to identify which type is your food trigger. And the only way to identify food triggers is by a systematic elimination with reintroduction. Otherwise, we're just cutting out food. And we've seen it again and again in our clinic, is that people were recommended the low FODMAP diet. They try it for years. It works for a while, and they stay on it for longer. Their symptoms get worse. They don't get better, and they continue to cut out more and more food. If that is happening to you, please stop cutting out food. Work with a dietitian that can help you identify, help you with your physician, right? Identify what is going on in your gut first, and then create a treatment plan with you and your physician. And then once your symptoms stabilize, reintroduce food back into your diet. Okay, we have a question here. What we do IBS with asthma patients? This is interesting. I don't believe there is a connection between IBS and asthma, but there is a connection between IBS and mast cell activation. So mast cell activation is your body, mast cell is the cells that produces histamine. And sometimes with IBS, if you also have mast cell activation syndrome, you can have more histamine being released in your body, and that can lead to more asthma or more hives or more other types of allergy reaction. But asthma itself, I do not believe have a direct connection with IBS. Yeah, but with asthma too, make sure you get tested for allergies, because allergies do cause asthma. And sometimes if you are allergic to certain food, it can present as GI symptoms. And we actually have seen people in our clinic who has a wheat allergy, right? Instead of having intolerances to food, they actually have a wheat allergy being presented, because the patient actually tested out of celiac, and we are like, well, it could, but they're still reacting to wheat. And the next thing we think is, do you have non-celiac wheat sensitivity, or is it a wheat allergy? So what we wanted to do is, hey, let's get you tested with an allergist. So with allergies, you have to go to an allergist to get tested. Do not do any any tests that are sold directly to consumers. Okay. Okay. Bakery foods that can trigger symptoms, and then we have another food allergen test. Food allergy test. So you go to an allergist office. There are two ways that they can do the food allergy test. One is the skin prick test, and one is blood work to measure IgE levels in your body. So not the food sensitivity test, okay? That's IgG. That's invalid. That's a waste of money. Do not do it. Okay, but always talk to a licensed MD who is also an immunologist or allergist. My family have a lot of allergies. We actually go, for my kids, we actually go once a year to get them tested for their allergies to see where they are with their allergies. But, talk to somebody who's specialized. Okay, is there a connection between, is endometriosis connected to IBS? Actually, yes. You know what? It takes about 6.5 years to diagnose IBS. It takes even longer to diagnose endometriosis. So with endometriosis, it's a disease, it's an inflammatory disease that spreads, okay? And if the endometrial cells that spreads to your colon, which in some significant severe cases, it can happen. If it spreads to your colon and attached to your colon, it can affect your gut motility. It can affect your bloating, your symptoms. So endometriosis itself have very overlapping symptoms with IBS. A lot of our IBS patients that we work with, if we see any red flags of endometriosis, we always send them back to a gynecologist that understands endometriosis. Now, with endometriosis, you have to go to a specialist. So there is a website called Nancy's Nook, where they talk a lot more about endometriosis and find you the right provider. Now, in our clinic, what we do with patients with endometriosis is, depending on your type of IBS, usually it's more bloating and more IBS-C. We worked on improving gut motility together. And in some of the cases, we see people do have a food trigger. And what does it look like to have a food trigger for endometriosis is when we cut out the food, their periods gets better. Their symptoms of pain from endometriosis gets better. And when we do the food introduction of certain foods that we think could be triggers, they get a flare, not just an IBS flare, but their gut reacts to it. But more importantly, they have endometrial pain as well in their abdominal area. So those are the things that we watch out for. So unfortunately, endometriosis, men endometriosis patients, I'm signing because it's just so hard to get the right diagnosis with endometriosis. It takes like often 10 years or more for women to get diagnosed. And oftentimes they are diagnosed with IBS first, and it's just debilitating. And then once you are diagnosed, finding the right provider to offer treatment is a tricky part. But if you do suspect endometriosis, and if you do suspect food triggers with endometriosis, work with a dietitian that can help you identify that food triggers. Because we sometimes do see patients, when they remove their food triggers, their periods get better, their pain lessens significantly. It's way more manageable, because one of the big symptoms of endometriosis is pain. Now, this is a really good topic for me to ask a specialist to join my podcast to talk about. But on the IBS Nutrition podcast, we had an episode with a colleague who is a pelvic floor therapist. And in that episode, we talked a lot about endometriosis and finding the right support for you. It is really important to do that. Okay, I hope that answers some of your questions, but that episode will offer you more, and I'm gonna I'm gonna answer more questions and also invite a specialist on endometriosis to the IBS Nutrition podcast, because I think there is a huge gap in providing the right care for patients with endometriosis. And oftentimes they're diagnosed with IBS, and we want to provide the resources and bridge that gap for our patients who are struggling. Somebody asked, give me diet plan for IBS. Everybody will have a different diet plan depending on what your triggers are and your tolerance to different foods. So if you are just looking for a general guide on the low FODMAP diet, we do have an IBS starter kit. Comment the the word food on any of my posts. I will ask you 2 questions in DM. One is your name and one is your email, and we will send you our low FODMAP starter guide. Now, however, remember the low FODMAP diet is not a forever diet. Okay, ulcerative protective person can join gym. I'm sorry, I'm not quite understanding the question, but actually we just recorded an IBS nutrition podcast episode with one of our past patients who has IBS and microscopic colitis. She came to us with non-stop diarrhea, and once identifying her triggers and removing her triggers from her diet and allowing her gut to heal, she's able to do so much more. She is somebody who actually teaches at a gym, and she goes to a gym a lot. So yes, it is possible for you to go to the gym, but you have to wait for your symptoms to be at baseline to do that. Otherwise, excessive workouts when you're not feeling well can exacerbate your symptoms. All right, everybody, thank you so much for joining me today. For those of you who are just joining, we talked a lot about food triggers for IBS today. I will post the replay of this session so that you can watch it from the beginning to the end. We also talked about probiotics, prebiotics, what they are and why they're important, and what are some of the probiotics foods that you can eat to help improve your gut microbiome. We also answered a lot of questions on overlapping conditions with IBS, for example, inflammatory bowel disease. We also talked a lot about the low FODMAP diet, as always, because it is the #1 recommended diet per research for helping with IBS. But remember, the key is to not stay on it for prolonged periods. It's only recommended for patients to be on it for 2 to 6 weeks, followed by a systematic reintroduction of all the FODMAP groups step by step to identify your triggers and understand your tolerance levels to these foods so that you can expand your diet. And that's always the goal when it comes to the low FODMAP diet. All right, thank you everybody for joining me. And a quick reminder, the IBS Freedom Program is enrolling now. Our enrollment ends September 30th. So we've already filled up 1 group, and we decided to open the 2nd group this weekend. And our 2nd group is filling up already. So we already had 2 new clients join our 2nd group yesterday. So if you're interested in working with us, we have a few spots left. Each group is only limited to 6 people because we can only help so many. We work very intensely with our patients to help them get better. We look at what you're eating, what your symptoms are, what your bowel movement looks like to guide our treatment plan, what we are doing, and also when to reintroduce foods. So if that is you, if you want to get better, if you want to work with us, and we work with your MDs as well to help you get the right test, get the right diagnosis, we have a few spots open. So you can comment group to get 3 links from me in your DM. The first link is the group program link. The 2nd link is our free IBS Relief Masterclass link. It's completely free. It's 45 minutes of education on IBS. What are the different triggers of IBS? And then the 3rd link is actually a link to book a call with me. I have a couple spots open next Tuesday for a call with me. So if you are interested to learning more or maybe speaking to me about your condition, you can do that. But those spots will be gone pretty quickly. So if you're interested in talking to me before signing up to the program, you're more than welcome to booking a call with me. All right, everybody, thank you so much for joining me today. If you're just joining here, we talked a lot about food triggers for IBS today. Check it out, watch the replay. Thank you, take care.